It's so good to have you back to this wonderful physical and health education class. Today, you will be learning about emergency conditions that requires first aid. First, let's look at the meaning of emergency. Emergencies are unexpected events or accidents that result in harm. Emergencies need to be attended to urgently. What is first aid? First aid is the first treatment or the immediate treatment given to an injured or a sick person before he or she is taken to the hospital. First aid is treated with materials from the first aid box. These are some of the materials from the first aid box. As you can see them, identify them. Why do we give first aid? What are the aims of first aid? First aid helps to save life. It reduces pain. It promotes recovery. It helps to get the injured person to the hospital. Examples of emergency conditions that requires first aid. What are some of the emergency conditions that requires first aid? The first of it all is bleeding. Bleeding is an emergency condition that requires first aid. Bleeding occurs when the arteries or the veins has been damaged, and so blood flows from the surface of the skin, and this needs to be attended to urgently. Dislocation. Dislocation simply means when the bone shifts from a joint. You can notice the movement of the bones from the joint. Now, when you lose consciousness and you fall down, it is called fainting. Fainting has to do with losing consciousness and falling down. It is also very dangerous. Another emergency condition is drowning. This is inability to breathe in water because an individual cannot swim. It can result in death through suffocation. Burns is next. Burns is the accidental touching of hot objects. It could be fire, or it could be an object that is very, very hot. Then burns can also result from hot liquid. This is called scald. Then we have bite and stings. The bite from either animals or insects. We have the scorpion stings. Is very, very dangerous, so it needs to be attended to urgently. We also have bee stings. Bee stings are very painful and dangerous, so it needs to be attended to. Snake bites. Snake bites are very, very deadly. It is a serious emergency condition. We also have dog bite. As friendly as dogs are, their bites are very, very deadly. So it is an emergency condition. Fracture is another type of emergency condition. Unlike dislocation, fracture simply means a broken bone. When a bone is broken in the body, it is referred to as fracture. Principles or steps in applying first aid to emergency conditions. What are some of the principles? These are the steps that you need to take in order to conveniently and effectively attend to an injured person. Step 1, identify signs and symptoms. That is, what are the signs and the symptoms associated with the accident? Is it bleeding? Is it wound? So you have to identify it. Then identify the particular condition. A symptoms can be seen in one or two conditions. So identify the particular type of condition. Then take necessary protective measures like wearing of hand gloves and face masks so that you, the first aider, can also be what? Safe. So you take necessary protective measures, then you apply the correct treatment. I repeat, the correct treatment. You apply the correct treatment, and after that, you take the patient to the hospital. When the patient is a little better, you take the patient to the hospital. This is the final step in applying first aid to an emergency condition. There are sometimes patients are unable to breathe, so you apply what we know as CPR. This is CPR in first aid, and CPR simply means cardiopulmonary resuscitation. Cardiopulmonary resuscitation. This is given to patients who are unable to breathe. Let's look at a simple way of giving a cardiopulmonary resuscitation. This is the 2 steps to save life. When you notice somebody suddenly is lying flat on the ground and cannot breathe, you call for help. Then you put your palms at the middle of the person's chest. Then you support it with the other palm. Then you push gradually. This helps to energize the heart so that the person can start breathing again. So give a push continuously. Remember, call for help as this is going on so that the patient can be revived. So you push continuously and the person can be saved. You push continuously. This helps to resuscitate the person. In some cases, you need to give a mouth-to-mouth CPR. That is, this involves blowing air into the person's lungs so that the person can breathe artificially. So this is done repeatedly on the person until the person regains consciousness. I know you've learned so much about first aid, and next time you see an injured person, you will not panic and you will apply first aid or call an adult who can apply first aid. See you next class. Bye.